Good afternoon, everyone. I am Dr. Hariri. I'm a board-certified allergist and immunologist, and I would like to thank Lupus LA for inviting me to talk a little bit about the immune system and how it relates to COVID-19 and what we know about the basics so far of COVID-19 and the inflammatory stage. And I would like to just kind of casually talk to you guys, show you some slides, actually printouts of slides that I had prepared for this talk and for other talks, and talk about how the immune system really plays a role in this new viral disease. I did want to tell most of you a little bit about my background first. So again, for those that just joined, I'm Dr. Hariri. I'm a board-certified allergist and immunologist in Los Angeles, California. I have privileges at Cedars-Sinai Medical Center. I also completed fellowship at the West LA VA program affiliated with UCLA. I did some rotations at Children's Hospital, Los Angeles, and I've been in private practice for about 5-6 years now. And I still go back and teach at our UCLA affiliated fellowship program where I see patients with allergists and immunologists in training. I enjoy teaching about allergy and immunology. And today, again, I'm honored to speak to the Lupus LA community. So let's start with a simple slide about COVID-19. By now, most of us, not everyone, knows that the World Health Organization named this new novel coronavirus a pandemic. And we've had obviously millions of people infected with this worldwide, several millions just in the United States, and over 500,000 people have passed away in the world from this viral disease. This is a simplified slide about the course of COVID-19 infection. And you know, COVID-19 is the disease caused by SARS-CoV-2. If you look at this slide, and I hope most of you can see this clearly, you see that I've simplified it into 3 stages. Stage 1 is basically the first stage where most people, if not all people actually, are asymptomatic. So this is the initial asymptomatic stage, and you somehow here you get the infection, and in most people this is anywhere between 4 to 14 days of absolutely no symptoms. In some people it could be a shorter period of asymptomatic phase, and in some people it takes a little bit longer. Up to 21 days of being infected and being completely asymptomatic has been reported. Now, of note, we know more recently that many patients will actually have COVID-19 or the infection, but will remain asymptomatic throughout phase 1, 2, and 3. However, they could still be contagious and spread the disease, and that's why social distancing and all the recommendations from the different medical bodies, especially the CDC, is so important, and especially, and we'll of course get to that, in patients with autoimmune diseases. So the initial asymptomatic phase, then that's stage 1, is followed by stage 2, when most people have, non-severe symptoms. And these non-severe symptoms, as most of you know, are cough, runny nose, sometimes, of course, chills, sweats, fatigue, headache. It's a long list, a loss of sense of smell, sense of taste. Some people will also develop some fevers right at this stage. Now, you see that there's a turning point in stage 2. So right in the middle of stage 2, you see that there's a turning point that not all patients experience. So some patients will never be symptomatic in this stage 3, but many patients, unfortunately, and usually, definitely the patients that get hospitalized, which is about 20% of all patients who get infected that actually need to be in the hospital, they will turn with this graph into this stage. And this is the hyperinflammatory phase or cytokine storm. And that's where immunology kicks in. Most of this is infectious diseases, right? And there's a lot of infectious disease specialists, of course, that directly treat COVID patients together with pulmonologists and other specialists. But my specialty really kicks in here. It's the inflammation that is mediated by the immune system. And so with this viral condition, the immune system is really important, and really the way it responds to the virus. Because interestingly, and this is pretty important, just like with COVID, just like with SARS-V1, so the first SARS infection in 2002, as well as with MERS, the Middle Eastern Respiratory Syndrome, those were the previous coronaviruses that became epidemics, but not pandemics. This pandemic is similar to that one. I don't know if my slides are backwards. I guess there are some comments coming in. The paper is backwards. Oh, I wonder why that is. I'm just holding, yeah, I guess it's because I'm just holding the slides up, so it's probably showing it backwards. I'm not sure what else I can do with this, but you know what we'll do is we'll maybe post these slides later on the Facebook, under the Facebook comments. So if you just listen, I guess, I'll show it. But basically at one point in the second phase, there's a turning point and you turn into this hyperinflammatory state. So interestingly, with all these SARS infections, so this including COVID-19, what happens is that people get really sick when the viral load is actually low. So the viral infection, the number of the viral load, when you check in the blood to see how much virus the patient has, you actually have very little when the inflammation gets high, which means that, of course, the infection started the process, but it's not a direct result. The direct process of, inflammation in the lungs or other organ systems is from this hyperinflammatory phase. So let's talk a little bit about the coronavirus itself. So here's a simplified diagram, and I hope this you guys will be able to see clearly. Okay. The virus itself is a very, viruses in general are small infectious agents. They have a very simple composition. They either have a nucleic acid with DNA or RNA and just several proteins with them. And the coronavirus is an RNA virus, so it has RNA in the middle. They've been identified in humans and even non-humans since the 1960s. And we used to have a lot of coronavirus, or we still do, infections before COVID-2, but most of those cases were very mild. Actually, 15 to maybe 30% of upper respiratory infections in anyone were coronavirus infections. Also, some of the pneumonias and lower respiratory tract infections that were usually treatable were also from coronaviruses. But an interesting fact is by the time a baby or a child actually is 4 years old, 75% of children show antibodies to at least some type of coronavirus. And of course, with COVID-19, we still don't know enough to talk about the immunity, exact immunity, but that's exactly what we're hoping, that, either through herd immunity or through a good vaccine, we will develop an immunity that is lasting. So in that hyperinflammatory state, which now that we know about the virus, and here's the virus, so a couple of things have to happen with the virus. I kind of highlighted here what we see, and you don't have to read anything, even if it's upside down or. But what you need to know is that this virus this is what the virus looks like, and it needs an anatomical structure to get into your cell. A virus cannot survive by itself, right? It needs a host to be able to survive in and to replicate or multiply, because what it does is it puts its genetic information in your cells, and that's where things can get bad. And so in the coronavirus, we know that the S spike protein, it's a protein that I highlighted, is what gets the virus in, and most likely through a receptor called the ACE receptor. So the first step of this disease is for the virus to successfully get in and get through the membrane of your cells. ACE receptors are cells that are found in a lot of different types of body cells. So they're definitely found in the respiratory tract, but there's also a lot of them not just in the lungs, in the GI tract. So the coronavirus, COVID-19, can get in the lungs, but it can also get in the GI tract because this S spike protein, this little spike, can attach to the cell in the GI tract. And that's why a lot of people get nausea and vomiting, diarrhea, and GI symptoms. Now, interestingly, the COVID-19 virus, SARS-CoV-2, can also attach to your immune cells. And so in lupus, there is a couple of things going on that can potentially put you at increased risk for this virus. First of all, someone with an autoimmune disease, a patient with lupus, the immune system is not always completely normal. And so when your immune system is already not normal, and now here is this virus attacking your immune cells, like the macrophages, for instance, who are supposed to kill, other pathogens, well, then you're already at a slightly higher risk of getting the virus. So that's one reason, because your immune system is often not working normally. And the other reason is obviously the medications you're on to treat the lupus. However, on a positive side, some of these medications, as most of you know through the media, have actually been shown to potentially be helpful and maybe even preventative. What's really interesting actually is that none of the medications that lupus patients take, that is specifically for the lupus, is an antivirus medication, right? Most of them are anti-inflammatory medications. And that brings us back to the immunology of this disease. When people are really sick in the hospital on a ventilator in the ICU, literally fighting for their lives, their viral load, the amount of virus that is detected in the body, is actually low, but the amount of inflammation is high. And that's when you're at this phase 3. And again, we are going to post these slides later in the comment sections of Facebook, of the Facebook post. So the other reason why you might be at increased risk if you have lupus or any other autoimmune disease is because of the treatment. So even though some treatments might be protective, others might not, because they're immunosuppressive. So when they're already suppressing an immune system that is not working well, you are more likely to potentially catch the virus. But we don't really know 100% if this is the case. The recommendation, and it is actually, and I would like to touch base on this now, it's actually one of the questions that we had been asked earlier on, is if, lupus patients should continue their medication. So the question actually was, I tested, here it is. So is it recommended to stop taking my lupus medications like my Benlysta infusion or Cellcept? The reason I would like to answer this question now is because we're talking about, kind of the risks and talking about treatment for lupus versus also preventative, maybe treatment even for COVID-19. And all the professional medical societies, including rheumatology and immunology, recommend that you continue your medication, so first of all, your disease is well controlled, because you don't want your lupus to be not well controlled. If you're getting something like Benlysta and it's only for milder symptoms, for some fatigue or some milder joint pains or for mild hair loss, and of course, if your rheumatologist agrees with it, it might be, may be reasonable to have a discussion with your rheumatologist to stop a medication like that, because at this point, at least, there's no evidence that Benlysta specifically helps COVID. However, you can never stop without talking to your rheumatologist, because if your lupus gets worse and it's not well controlled, you might be at much higher risk. And this is one of those pre-existing conditions where, you might have what we in immunology call a secondary immunodeficiency. So your immediate condition is not having a deficient immune system. You have an autoimmune disease where there's antibodies attacking your body, and that causes a secondary immunodeficiency. But it depends on how well your lupus is controlled. People whose lupus is pretty well controlled on their current medication should continue to take their medication so it's controlled. If people stop their medications and just because they're worried about COVID-19 and then their lupus gets worse, their antibodies go up, their inflammatory markers go up, then you might be at much higher risk. So I think most physicians and most academic societies who make these guidelines and suggestions recommend that you should continue taking all your medications. The inflammatory stage is caused by something that you might have heard called cytokine storm. And so I wanted to talk about cytokine and what this really means, because once you get the infection, the virus causes that all these immune mediators, these chemicals or mediators and cells that are made by the body to actually, get higher and higher. And so there's two main types of mediators or chemicals that the body makes in the immune system. One, they're anti-inflammatory, so they suppress inflammation. And two, they're pro-inflammatory, so they make inflammation worse. Well, in COVID-19, and I'm just going to show this slide hoping that you can kind of see what's going on. The only thing I really want you to focus on is this pink highlighted area. In COVID-19, we know that at the end, if you do develop that hyperinflammatory stage, what will happen is your interleukins, which are all these, cytokines. So cytokines are chemicals that are released through the immune system that cause inflammation. Well, those go up. So see, you have more release. It's these three that you have released here. It's called IL-1, IL-6, and TNF-alpha. And so when you have more of this release, guess what it does? These released mediators that cause inflammation also make your cell that's infected with this COVID-19 make even more. So whatever is released makes your cell release more of the same. And so you end up in this vicious cycle. So IL-1, IL-6, and TNF-alpha are cytokines or immune cells or immune mediators, products or substances that cause inflammation. So, and the way they do it is they make your cells make more of themselves. So you're in this vicious cycle, and that's when, you can end up with severely affected lung disease. And unfortunately, we know now that COVID-19 doesn't only affect the lungs, even though the lungs are one of the first organs or most seriously involved organs, but it can affect the kidneys. It can affect the coagulation system. So blood clotting can happen, and multiple organs can be involved, just like lupus when severe. And that's why if your lupus is not well controlled, or if you have organ systems that are involved, like the kidneys or the lungs, you are at higher risk for having a more serious illness with COVID-19. So this cytokine storm that we hear about, I just wanted to share the definition of what it really means. So just a subgroup, but we don't know exactly, but let's say about 20%, those that get really sick, those that go into the hospital, they have severe COVID-19 and they end up with this cytokine storm or cytokine release syndrome. Cytokines, again, are those things that I just mentioned are released. Again, IL-1, IL-6, and TNF alpha. And the definition of cytokine storm itself is a hyperinflammatory condition where the immune system produces an excess of these pro-inflammatory cytokines, uncontrolled, and generalized inflammation through the body happens. And this can affect multiple organ systems and cause death. An interesting fact is that cytokine storm is not just unique to COVID-19. Actually, autoimmune diseases, well, when they're not well controlled, they can cause cytokine storm. Lupus can cause cytokine storm when it's uncontrolled. COVID-19 as a virus can cause cytokine storm. So that's why it's probably extremely important, not probably, it's always extremely important, but also in COVID-19 to control your lupus well and not to stop your medications without talking to your rheumatologist, including biologic or immunosuppressive agents like Celsep, like Benlysta, like Actemra, etc., etc. So, unfortunately, people are commenting that my slides are not clear or are not showing correctly, so I'm going to skip showing some of these slides. So if you bear with me for a moment, then, because the slides remind me of where I am in my talk today. But you know what? This one, actually, I would like to show you just to clarify something here. And this one, again, don't read the words at all, but if you could please just look at what you see here in the diagram, and I think even if it's upside down or opposite direction, you see that this is a patient, right, or a human being with lungs, right? And these purple little balls are COVID-19. So if you're not wearing a mask, and even sometimes, unfortunately, with the mask, but if you are exposed to someone and you're inhaling COVID-19 viral particles in the lungs, then if you look here is the yellow here and these blue cells and these blue cells are all part of your immune system. They go haywire after a while in some patients, and they release all these little balls called the cytokines. Cytokine storm happens in the lungs, and you get all these things. And there are some reports that in lupus patients, one of these cytokines, at least the TNF alpha, is already abnormal to begin with. And because it is abnormal to begin with, you might be more susceptible to getting the disease. There is a lot that goes on in cytokine storm, but the one thing that I think that we should all remember and we should really focus on is the fact that in cytokine storm, it is really a vicious cycle, and it keeps getting worse and worse and worse because what is released causes other things to be released. Okay, so now that we talked a little bit about, the immune system, the abnormal cells, and, causing the inflammation, remember, none of this is directly the infection. It's all the immune system that is, extra inflamed. I wanted to talk about and I'm seeing some questions coming in about hydroxychloroquine, which is Plaquenil, which again has been used for many, many years pretty successfully in most patients with no significant side effects. But of course, again, your rheumatologist has to determine if you are a candidate for it. But if we look at that same mechanism, and I'm going to try to make it very simple, I'm going to post this later, but if you look at this, this is a cell. This is a cell, and these green dots are all COVID-19. Well, what Plaquenil does, and it's right here, hydroxychloroquine, it decreases inflammation in lupus, but it also changes the milieu or the environment of the cell here, the pH, so the acidity, and it prevents possibly the virus from getting in. So even though studies have shown that if you're already really sick, right, you have COVID-19 that's really severe, you're in the ICU, and if at that point you got hydroxychloroquine, there might not be a benefit at all because you're already it's really advanced and you have that hyperinflammatory state. But if you get hydroxychloroquine because you have it for your lupus, you happen to be on it, you actually might be protected. Not 100% maybe, but you might be protected from getting a severe reaction, or you actually might not get any symptoms. We don't know that yet, but it makes sense if we look at this. And, some studies were done and retracted, and some studies were more about inpatients, and then some studies showed maybe a benefit, right, that people improve quickly. But we don't know because it's not a randomized controlled trial. We don't know if these people would have gotten better anyway. But if you are on Plaquenil and your rheumatologist want you to be on Plaquenil, which is hydroxychloroquine, you definitely should continue it because there actually might be a benefit. I want to talk about two medications that are actually showing some benefit in that really strong, actually three, when you actually are really sick. So showing this graph again, when you're in phase or stage 3, which is the inflammation. And when patients are really sick and they're in the hospital and they have what's called acute respiratory distress syndrome, right? Your lungs are in ARDS. So you might need to be on mechanical ventilation or life support. That's what a ventilator is. To breathe for you temporarily, hopefully, until you can recover. There are two medications, and guess what? Those two medications, and there's more that have been studied, but two that have somewhat good data to show, stop those other two mediators, IL-1 and IL-6 that I mentioned. So remember, there were those three that there's more than three, but three that definitely seem to be causing that hyperinflammatory response. Well, there's two medications, and guess what? One of them is used for rheumatoid arthritis. It's called Actemra. But it is also used for lupus in some patients. And Actemra, the generic name is tocilizumab. And there were some studies done in Italy as well as in the United States that show that if you got Actemra, only I think 2 doses, so 1 dose and then some people got another dose of Actemra or tocilizumab, it blocks the cytokine storm, that IL-6, in a lot of people. And there was a significant improvement in a large percentage of patients who could come off the ventilator and improve within 24 hours. That's another reason why patients who are on Actemra, even though they are immunosuppressed, right, their immune system is weaker, so they might get the disease initially, they might not actually end up having this hyperinflammatory stage, because people who got that medicine, people without lupus, who got that medication when they had COVID-19 in the ICU, actually improved. And some of them ended up not needing the ventilator. And they're still doing bigger studies, but the biggest one was done in Italy. As you guys know, northern Italy was the epicenter for a lot of this stuff. But they actually improved, and they did it in 300 some patients, and they enrolled now 1,200 patients. But there was just a manuscript; it hasn't been published yet. But that seemed very promising. When patients in the hospital with bad COVID-19, when they measured their levels of this IL-6, this other ones, TNF-alpha, IL-1, they were really, really high. And you might remember terms like your SED rate, ESR, or your CRP, which are routinely checked to see if your lupus is under control. Well, when those levels are checked in patients with severe COVID-19, the more severe the COVID-19 case is, if you're in the ICU, the much higher the CRP is, sometimes in the hundreds, 200, 300. And even though those levels were really high in some of these patients when they got the Actemra or the IL-6, for instance, many of them, not all, but many of them improved. The other medication that was studied is an IL-1 inhibitor. So cytokine storm and the immune system, even though it's interesting, it's hard to make it interesting when you talk about it with all these numbers and letters, IL-1, IL-6, but they're basically just substances you need for a normal immune response. But when they get really, really high, because the body notices there's this virus that is foreign, like, what is this virus? It's attacking my body. Well, it should be able to clear it normally, and a lot of people can, including some lupus patients. They will have some symptoms, but they will not have the very hyperinflammatory response. Some say maybe because of the plaquenil, or maybe because of things like Actemra, because it stops your body from going into this vicious cycle and going haywire. So the other one is the IL-1. You guys might have heard of the medicine, and maybe some of you are on it, but it's usually used for other conditions from lupus, autoimmune conditions, called anakinra. Anakinra is an IL-1 inhibitor, and people who were on anakinra, they actually quickly, in some of these trials, improved, and they ended up not needing to be on a ventilator, or not needing, or basically it prevented death in them, and they went home. In one study, 7 out of 10 really severely ill patients, when they got this immunosuppressive drug, anakinra, it stopped that vicious cycle, and they actually were able to go home. So 1 went to rehab from the 7, 3 didn't make it, but 6 went home with self-care. So this gives a little bit of hope, and of course we need randomized controlled trials, but I really feel as an immunologist that if we can target that hyperinflammatory stage or phase of this disease, that we might be able to treat COVID-19 successfully. There are some studies that are ongoing now. Some are in China, some are in Europe, but it's all about basically most of these. Some are antiviral, so you might have heard of a drug called remdesivir, right? Remdesivir is an antivirus drug, but most of them actually are more anti-inflammation drugs, and it's all to stop that cytokine storm, right? So since we don't have good treatment for COVID-19, and since we don't have an effective or good vaccine yet, I know what some of you are thinking. Well, we just found out that some of the initial trials are showing on humans already, are showing that a lot of people developed antibodies, and not only did they develop antibodies, they also kept T cells. So your immune system has different types of cells, but some vaccines only make antibodies, right? It's called the IgGs. But in these patients, what happened was from the vaccine, they got the vaccine, and they were able to also have T cells, so they have double protection. And if this is really the case, then we really might have a vaccine that is very effective. I actually want to spend a few minutes and talk about something that is very simple but interesting. Vitamin D supplementation. Vitamin D is in David. Some of you might be on it. So we've known for quite some time now that vitamin D is very important for bone health. But we also know that vitamin D has extraskeletal. So outside of the skeletal system, outside of the bone, it has some positive effects, right? There's a lot of epidemiologic data showing that vitamin D might be very helpful in heart disease, so cardiovascular diseases. Vitamin D might be very helpful in metabolic diseases like diabetes, and vitamin D might be very helpful in infectious diseases. There's definitely evidence that vitamin D has helped in non-COVID patients, but other reasons where they went into acute respiratory distress, ARDS. And so we know that vitamin D also might play a role in autoimmune diseases, and possibly in my bread and butter, allergies, like allergic diseases. So we definitely know, even 5 to 6 years ago, that people who have good high or above normal vitamin D levels, they actually were able to prevent severe allergic reactions. They had less anaphylaxis. And so I think it's really important to focus on vitamin D now because now there is some observational data. So again, no randomized control trials, but there's some data on vitamin D and is showing that it might be preventative and prevent worsening COVID-19 infection. And I think it's something really easy to do for everyone to take vitamin D supplements. And of course, I'll go over the specifics. So why is vitamin D important? If we think that, it's the cytokine storm that's going on, right? It's all this inflammation that's going on. Well, vitamin D receptors are on all immune cells, or most. They're on the B cells. They're on the T cells. They're on what we call antigen presenting cells, when the cells that present the pathogens to the body. And so since vitamin D is really modulating the immune system, we know that vitamin D can decide if you get a lot of pro-inflammatory, very hyper-inflammatory cytokines, or if you get anti-inflammatory cytokines. And so since COVID-19 is a lot about inflammation, a lot of people started, really study this relationship. And I want to talk about one study, and this is easy to follow, even if this graph is not very clear. Just look at the colors, and I'll tell you what I'm talking about. So, in South Asia, they looked at 212 patients with really severe COVID-19. Actually, not severe, all kinds of COVID-19, but 212 patients with positive coronavirus testing for COVID-19. And if you look, the ones that were critically ill, which is this bar here, right? You see that the green means a normal vitamin D level of 30 or above 30. From the ones that were really sick, most people didn't have a normal vitamin D level. Only 4 did. A lot of them had a slight, like a moderately low level, that's the orange, and many had a really, really low vitamin D level, which is the red right here. If you look at kind of the severe, not critically ill, but the severe COVID patients, you also see that most people didn't have a normal vitamin D level. If you look at this bar here, right, you see that these are the kind of moderate COVID-19 cases. You see that a little more patients had normal vitamin D levels, but still most of them don't have vitamin D levels. And if you look at mild disease, look at that. This is impressive because the patients with mild COVID-19 actually had a normal vitamin D level, except for 2. Green is a normal vitamin D level. What we consider a normal vitamin D level, by the way, is above 30. But there is a recent study that was published, and it looked at all-cause mortality, which means death from anything, not just coronavirus, right? So in general, they saw that if your vitamin D level is above 60, there was less death, and there was less cancers. And so it looks like having a good vitamin D level, even above the recommended 30, may be the new recommendation, not yet, but might be even above 60, because it looks like it's protecting you from all kinds of diseases. We know there might be some benefit with autoimmune diseases. Now we know that there might be a very big benefit maybe from COVID-19. So then what researchers did from Northwestern University in Chicago, Illinois, they looked at 10 countries with different COVID-19 rates. As you know, Italy and Spain were hit really hard, right? And the United Kingdom, they had a hard time with COVID cases. And then at the time of the study, they also looked at some other countries like Norway, like Finland. And what they did is, and see if I can show you the slide, but what they did there is they actually, they also looked at China and Germany and Korea, and they saw that the countries with the lower vitamin D levels actually had more disease. Then there was another study. They said, well, this is interesting. So this other study looked at 20 European countries. And they confirmed that decreased vitamin D levels were associated with more COVID-19 cases. and even more mortality rates. So low vitamin D levels, more death from COVID-19 in these 20 countries. This showed that in Italy and Spain, where patients had higher COVID-19 mortality rates, they actually had lower vitamin D levels than some of the other European countries where they had a lower mortality rate. Now, of course, there are other variables there, and people looked at some of those, like maybe there's other reasons. But we know that healthcare in northern Italy is actually pretty much one of the best that in the world. It's not necessarily much worse than other European countries or the United States. Then why did they have such severe cases even before the ICUs were overwhelmed? One of the hypotheses is their vitamin D levels were lower than many of the other countries, and so was as well as the patients in Spain. So they then were thinking, well, and this is probably what you're thinking, well, in Italy, a lot of people, the southern European countries, there's actually more sun, right? Well, it appears to be that patients in those southern countries, especially the elderly, really try to avoid sun. And it looks like in the countries where you had the lowest mortality rates and COVID cases, like Norway and Finland, a lot of patients actually have more vitamin D supplementation. They have a more cod liver oil in their diet. And those Scandinavian countries had the lowest number of cases. I'm not talking about Sweden specifically, there was no social distancing, but I'm talking about from the countries that they looked at. And so one of the reasons that we think also might play a role in Italy and Spain and the southern European countries having lower vitamin D levels is hyperpigmented skin. So patients that have a fair skin color versus patients that have darker skin colors, patients with darker skin colors actually have a harder time absorbing vitamin D. So less vitamin D is made from the sun. And that might be a reason why the vitamin D level was actually lowered. So, in conclusion, we're seeing more and more evidence that low vitamin D level is possibly associated with higher COVID-19 cases and also more severe cases and more death. We need randomized controlled trials. One more thing I wanted to mention before I go into answering some of the questions that I got from some of our lupus community patients is that there was also a study done that looked at people in hospitals and institutions like nursing homes, right? And they saw that 75% of those patients had low vitamin D levels. Well, there's obvious reasons because they're more indoors, right? So there's less sun. Also, a lot of them were not on vitamin D supplementation. And we see that besides the fact that they're in an enclosed space and so COVID might spread more quickly, that from the patients that, they were in institutions and got COVID-19, 75% of those people actually had vitamin D deficiency, which in addition to pre-existing conditions might be another reason for, severe mortality or severe COVID-19 or higher mortality rates. So in regards to vitamin D, well, how much vitamin D are you supposed to take? One of the questions was, what is the appropriate dosage of vitamin D for someone with lupus? Well, first of all, I don't know what the appropriate vitamin D dosage would be specifically in someone with lupus. There's some doctors that recommend higher doses of vitamin D because of possible improvement in autoimmune diseases or better control. So, however, what we recommend most patients to take is first of all, your vitamin D level has to be definitely therapeutic. If it's less than 30, you might need to get really high dosages. So some patients take 50,000 units once. A doctor prescribes it, obviously, if the level is low, and then they continue with 5,000 units a day. Your doctor might say just take 5,000 units, but I want you to ask your doctor, but what we usually recommend is that you take at least 2,000 to 4,000 units a day. If, again, your doctor is okay with it, I would say 2,000 to 4,000 units a day right now without even having to check your level unless you've had a history of low vitamin D level or you happen to be at your doctor for another reason. But right now with this pandemic, I don't think it's the right thing to do to go out and, just to have your vitamin D level checked. It's really unlikely for a good vitamin D supplement to cause much harm. So even though you have to ask your own doctor, I think that at least 1,000 to 2,000 up to 4,000 units of vitamin D a day should be very reasonable. Um, More studies are coming. I believe Harvard is going to do randomized controlled trials. I'll find out, and maybe in the future we can talk about that. And this is regarding COVID-19, of course, and vitamin D, not lupus and vitamin D, but this pertains to all of us. Another question that I got is, it says, how long does it usually take for a lupus patient to recover? Well, that question is really difficult to answer in any patient. As you guys know, many patients, some sources say up to 30 to 40% of patients who get COVID-19 are asymptomatic, okay? Completely asymptomatic. And then some patients are extremely symptomatic even when they're 25 years old and completely healthy. So I think it's really individual. It's likely that if your lupus is not well controlled, if you have organ involvement, if you have kidney disease, if you have liver disease, if you have lung disease, that it will be harder and take longer for you to recover. But there is no specific period for someone with lupus and recovery of COVID-19. Again, I touched upon the fact that we think, and most academic societies think, that you should continue your lupus medications, including things like Cellcept, Benlysta, if you are on things like Actemra, etc., because some of those might even be beneficial in that hyperinflammatory stage. So you have to talk to your own rheumatologist and see. But if you have very well controlled lupus and you're only on certain infusions, like Benlysta, that are for milder symptoms, then you might want to talk to your rheumatologist and discuss benefits versus risk. But do not stop any of your biologics by yourself because of fear of going into the office or because of fear of suppressing your immune system. Because remember, again, some of the medications used for lupus might actually help with the COVID-19 fight if you were to get it. The next question says, I tested positive for COVID and had most of the severe symptoms in the cytokine storm. So I assume you had fevers, shortness of breath. It says, thankfully, I was able to fight it from home. My question is, once having COVID for the first time and having lupus, rheumatoid arthritis, and being a diabetic, will I make antibodies? What are some tips as I continue to recover and after fully recovering? I think that's a really good question. So far, there is no studies that have been published regarding if lupus patients can mount antibodies. So what this question is basically asking is, if you have lupus or rheumatoid arthritis or diabetes or any other autoimmune disease, and if you get COVID, right, and then you recover, have you made antibodies? Well, if you recovered, then your immune system was able to fight your infection, and you probably made, you made IgM antibodies and you made IgG antibodies. And so after that asymptomatic phase, your immune system starts making these antibodies. But will you be able to make enough is the question if you have an autoimmune disease to remain immune to the disease. Well, first of all, we don't know if lupus patients can make antibodies, but I think that just based on to COVID-19, that is enough to remain. But we do know that many lupus patients that have gotten COVID-19 have recovered. Some have gotten much sicker. So some patients were able to mount antibodies. I also think that it depends on how well your lupus is controlled and your rheumatoid arthritis. If your autoimmune disease is well controlled and you don't have a secondary immunodeficiency, like the lupus causing you not to be able to have make antibodies and have a good working immune system, well, then you might not be able to maybe mount enough antibodies. But really, we don't know. We also don't know if everyone without even any autoimmune disease or pre-existing condition is able to make enough antibodies after getting infected. We know many do. So I think my recommendation would be to this patient with lupus and RA and diabetes who got COVID, that at some point you can just test and do a blood test and see if you have made the IgG antibodies, and your doctor will order the test. You maybe next time with your regular blood work for your lupus, so there's no rush to doing this, and you can see if you've made antibodies. But then the next question now with COVID is, we don't even know that if you have antibodies, if that really means that you can get the disease again. Some patients, after they've actually recovered, will get another kind of phase with illness. Sometimes it's a week later or just a few days later after going home. That's not necessarily because you got COVID-19 again. It's probably because you just got another, either the medicine that they were giving you in the hospital, like plasma, or like some of those immunomodulatory agents, right? Like Actemra, tocilizumab, or anakinra, or remdesivir, if they gave you an antiviral. Maybe it's because you stopped the medicine too soon and the virus got active again, or maybe it just started because you got a second wave of hyperinflammation. But there's still a lot that we need to do, but it's a very good question. So many lupus patients probably should be able to develop antibodies to COVID-19. It depends on how severe their disease is, but we still do not have any published data. It says here, can you catch COVID-19 from food or restaurant delivery? Well, that's one of the things that a lot of patients, including not just my patients, including myself and my family, were thinking of. Well, now we're at, we have stay-at-home orders, and even though we enjoy cooking, every day might be a little too much. Sometimes you want some food delivered. Is that safe? Well, there's no evidence that the virus really lives in food. Definitely some surfaces, frequently touched surfaces in public places, and if your outside doorknob or elevators, you got to be careful, right? Because we do know that the virus can exist for a certain amount of time on surfaces. So definitely use hand sanitizer. Washing your hands frequently really does work if it's done appropriately and correctly, and wearing masks when in public places, and to protect each other. Really, when you're wearing a mask, you're also protecting others. But I really do feel that because we don't know 100%, that patients with autoimmune diseases have to be a little bit more extra cautious and try to only leave your home if you really have to at this stage. Definitely stay away from large crowds. In regards to the food and restaurant delivery, I think that it's probably very safe if you are taking precautions, wearing gloves, you're not touching your face, to get the box and maybe take the pizza out and maybe put it in a microwave or reheat it, which potentially would kill the virus. Although there is no evidence that the virus lives in food, and but the packaging and stuff, there might be a risk. The biggest risk is person to person, someone talking to you closely, someone, without wanting to, transferring air droplets basically, by coughing, by sneezing, by just speaking loudly or sometimes not loudly, by, indirectly basically spitting. So if you're inhaling those from person to person, or if you did touch somewhere where the virus really was and there was a good amount of virus, then, and if you then touch your face, you might get it. So I would say that it's probably safe to order food and to go or take out and have it delivered to your home, or if you go to a grocery store, or ideally you'd have your groceries delivered at home, that you cautiously unpack and maybe wipe off some of the touched stuff, or leave the plastic bags outside, etc. So do take some precautions, and definitely after unpacking, wash your hands. But we don't think that by just eating a food you're going to get COVID-19, because the COVID-19 is in that salmon that was delivered. It's more maybe the packaging. At this point, there's no evidence that it's a food-borne illness, basically. A question that came in is asking, do lupus patients that have COVID-19 have better outcomes or worse outcomes? Again, we don't know. we know that it is a pre-existing condition, and some people with poorly controlled lupus might actually be more susceptible to getting the virus. But then some of the treatment options, like if you're on, again, Plaquenil for your lupus, you definitely should continue it because, as I said, patients, that are on hydroxychloroquine or Plaquenil might be protected from the virus gaining entry into the cell because the pH, the acidity is changed. So when that environment in your cell changes because of taking Plaquenil, plus the fact that it has an anti-inflammatory benefit, right, which is the benefit that we see in lupus patients when they take Plaquenil, you definitely should continue it. But some lupus patients, if they have organ involvement, since COVID causes kidney disease, blood clots in some patients, lung disease in some patients, if you have advanced disease or severe lupus, you might have a worse outcome. Another question that came in is asking, how critical is it for us to take precautions during this pandemic? I'm worried my employer does not believe me, even with a doctor's note. I'm an elementary school teacher. Well, this question is hard to answer. I definitely am an advocate of taking strict precautions for all of us. Social distancing has proven to help, and I think we should socially distance as much as possible for several reasons: to flatten the curve, to not overwhelm the system, but also to wait that if we, are going to get the disease, there might be better treatment. We might actually have better answers to these questions that you guys are asking. We will hopefully know because scientists are working on finding better treatment. And if some of these biologic agents, these infusions and injections that lupus patients are getting, some of them are actually actively being studied, and they're mainly rheumatoid arthritis meds, but also used in lupus. They're actually being studied for COVID-19 treatment, and also socially distancing until we have an effective vaccine. And if we do have an effective vaccine and we have better treatment options, if you were to get the disease, then hopefully it would be a much better outcome. Again, taking vitamin D. Now, to answer the question of if a teacher with an autoimmune disease should go back to the classroom, I actually probably would recommend against that at this point, depending on how severe your lupus is. But dealing with kids, even though there are some studies, right, saying that most kids are not carriers, they're not giving it to their teachers and parents. Some schools have reopened in Europe and it's been safe. Right now here in Los Angeles, I know schools are not going to be reopening in the fall yet because of the surge. So I would actually recommend you as an elementary school teacher, of course, ask your own doctor. I don't know the specifics of your autoimmune disease and how bad it is, but I would probably say, no, you do have to take strict precautions at this time. And I would say that just if you are on Plaquenil, let's say, or other medications, it doesn't mean you're completely immune, right? Even if many patients are protected, your disease might not be as well controlled and you might actually get really sick. So at this point, if possible, I would recommend working from home remotely. And so I know there's a lot of questions coming in still regarding this, but what I'm going to do is we're going to, I think, do a blog, or maybe we'll do another session to answer more of your questions. In regards to the vitamin D, there's some questions that came in regarding, again, dosage. You really have to ask your doctor, but I feel that everyone at this point with an autoimmune disease who is okay with taking vitamin D per their doctor should probably be at between, again, anywhere from at least 1,000 units to 2,000 or 4,000 units a day. If you are vitamin D deficient, it depends on your level and you really should probably take more. But there is definitely some good data coming in that vitamin D levels, if you take sufficient vitamin D, you might be protected or at least have much less of a severe coronavirus 19, COVID-19 disease. Thank you again for this opportunity. I really want to thank Lupus LA again for giving me a chance to share a little bit of my insight of immunology, and I enjoyed talking to the community, and I hope I will come back soon to answer more of your questions. I wish everyone to a very safe and healthy weekend. Please continue social distancing, follow the CDC guidelines, please follow your state mandates. This is a real disease, and this can really have bad consequences. But as a final word of advice, don't be extra anxious. Do your lupus treatment. Just because you have lupus, it does not necessarily mean that you are going to do very poorly if you were to get sick. There's more and more data coming out that we might have successful treatment. Take your vitamin D supplementation if okay with your doctor, and stay safe. Goodbye, everyone.